In the United States, someone has a heart attack every 40 seconds. But our understanding of this emergency is dangerously outdated, shaped by what we see in movies. The frightening reality is that for many people, especially for women, the warning signs don't shout, they whisper. They disguise themselves as indigestion, fatigue, or anxiety. The biggest danger we face is not the heart attack we can clearly feel, but the one our own mind tells us to ignore. Today, we are going to unlearn the myths. We will uncover the 5 most commonly missed warning signs of a heart attack, understand why they present so differently in men and women, and learn the critical actions you must take. Because when it comes to your heart, there is a golden rule. Time is not just time. Time is muscle. First, let's be clear about what a heart attack is. It occurs when a blockage, usually a clot, cuts off blood flow to the heart muscle. Unlike a stroke, which is a brain attack, a heart attack is a crisis of the heart itself. And when the heart muscle is starved of oxygen-rich blood, it begins to die. So, what are the silent whispers your heart might send as a warning? Number 1. Unusual and profound fatigue. This is not the ordinary tiredness you feel after a busy day. This is a deep, debilitating exhaustion that comes on without explanation. You might feel breathless just walking from one room to another, or making the bed. It's a complete loss of energy that rest doesn't seem to fix. Why does this happen? When your coronary arteries are narrowing, the heart has to work much harder to pump blood through a smaller opening. This extra work drains your body of energy. This is one of the most common signs in women, appearing weeks or even months before a major heart attack, yet it is so often brushed off as just stress or aging. Number 2. Shortness of breath with no exertion. You're sitting in a chair reading a book or walking slowly to the kitchen, and you suddenly find yourself needing to gasp for air. This feeling of breathlessness when you're not doing anything strenuous is a significant red flag. When the heart struggles to pump efficiently, blood can back up in the veins that go from the lungs to the heart. This pressure can cause fluid to leak into the lungs, making it difficult to breathe. You might find you need to prop yourself up with extra pillows at night just to catch your breath. Number 3. Nausea, indigestion, or upper abdominal pain. This is another symptom that disproportionately affects women and is dangerously easy to misdiagnose. You might feel a discomfort high in your abdomen, similar to heartburn or indigestion. You might feel nauseous or bloated for no clear reason. This occurs because the nerves from the heart and the stomach send signals to the brain through the same major nerve pathway. Your brain can get confused and misinterpret a distress signal from your heart as a problem coming from your stomach. You might reach for an antacid when what you truly need is emergency medical attention. Number 4. Cold sweats or dizziness. You're not hot. You haven't been exercising, yet you suddenly break out in a cold, clammy sweat. At the same time, you might feel dizzy or lightheaded, as if you're about to faint. This is your body's sympathetic nervous system kicking into high gear. Your body senses that your heart is in trouble and triggers an emergency fight or flight response. The cold sweat is a direct result of this alarm system being activated. The dizziness comes from a drop in blood pressure because the struggling heart can't pump blood effectively to your brain. Number 5. Pain in other parts of the body. We are all conditioned to expect pain in the center of the chest. But a heart attack often sends pain signals elsewhere. This is called referred pain. You might feel an aching or discomfort in your jaw, your neck, or your upper back between the shoulder blades. You might also feel it radiating down one or both arms, not just the left one. Again, this is due to the shared nerve pathways. The brain isn't sure where the pain signal is originating, so it tells you your jaw hurts when the real problem is in your heart. Now, one of the most crucial things to understand is that heart attacks are not a one-size-fits-all event. In men, the symptoms are often more classic. They are more likely to experience the crushing central chest pain, often described as an elephant sitting on their chest. The pain may radiate down the left arm. In women, the presentation is often entirely different. While some women do get chest pain, they are far more likely to experience a combination of the subtle signs we just discussed: overwhelming fatigue, shortness of breath, and pain in the upper back, shoulders, or jaw. This is why women's heart attacks are so often misdiagnosed or diagnosed late, sometimes tragically too late. So, when do these whispers turn into a full-blown shout? When is it time to act immediately? The phrase "time is muscle" means every minute that a coronary artery is blocked, more of your heart muscle dies. That damage is permanent. You must call 911 without a second's hesitation if you experience these signs. First, persistent chest pain or pressure. A feeling of squeezing, fullness, or burning in the center of your chest that lasts for more than a few minutes or goes away and comes back. Second, severe shortness of breath. You feel like you are suffocating and cannot get enough air into your lungs. And third, a combination of any of the other symptoms. For example, if you suddenly break out in a cold sweat and feel nauseous and have jaw pain, you do not wait to see if it gets better. A simple way to remember the key signs of an active heart attack is to think of 3 words: pain, air, cold. Pain in the chest or other upper body areas. Air as in shortness of breath. Cold as in a sudden cold sweat. This is different from the BE-FST rule for strokes. Both are emergencies, but they have different signs. Finally, the most important thing you can do is prevent a heart attack from ever happening. An estimated 80% of cardiovascular diseases are preventable. It starts with simple choices. Clean up your diet by focusing on fresh vegetables, fruits, and lean proteins while reducing processed foods and sugar. Move your body. A simple 30-minute walk each day is one of the best things you can do for your heart. Manage your stress and prioritize getting 7 to 8 hours of quality sleep each night. And finally, know your numbers. Regular checkups for your blood pressure, cholesterol, and blood sugar can catch a problem before it becomes a crisis. Staying healthy is a choice you make every day. If you found this information valuable, please share it with the people you love. You never know when this knowledge could help save a life. Have you or a loved one ever experienced one of these subtle signs? Sharing your story in the comments could help someone else connect the dots. Thank you for watching.